Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, question analysis, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Now, I've been doing this since 2015, y'all, assisting nurses and nurse practitioners internationally with exam success. I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. You'll start to notice a pattern, especially in areas that I know that y'all have told me you have difficulty in, or during my sessions, I have noted a common theme where you guys may struggle. That I'm doing series right now, and what I do with my questions is I build them, I stack them, so you can progressively learn how to approach questions. So some of them may seem very simple when I'm asking from a straightforward knowledge standpoint. That's just to strengthen that muscle memory and give you that good foundational knowledge. And then you'll see the application side. I always say that, but I like to explain it if it's your first time finding one of my videos or anything, so you know the approach that I have. Now, this week we are getting started on our diabetic series. I get a lot of questions on type 2 diabetes and medications, etc. So we're going to hit this to make sure y'all know it. I've also designed some worksheets for y'all, so y'all see those trickling out throughout as well, because I'm just trying to find it in an easier fashion. Y'all know I'm the short and sweet, eliminate the fluff girl for y'all, so that y'all are able to quickly identify what you need to identify and just review it and study it and build, right? So that you are able to be, as I always say, successful on boards as well as in practice, so that you can use this to assist you with answering questions, to assist you in studying for exams in schools, but it's also an easy tool and things to be able to navigate easily in practice. So, I'm a charts kind of girl and just condense everything. So I felt like worksheets might help y'all in some of these areas that you feel kind of overwhelmed with. So you'll see those as well. So I'm just trying to give y'all different ways to study a little bit easier. But let's get into these diabetic questions. All right. Question number one states, the nurse practitioner and NP student are discussing type 2 diabetes. What fasting plasma glucose reading is abnormal and a positive for diabetic diagnosis? Is it a fasting plasma glucose of 100 milligrams per deciliter? Is it B, a fasting plasma glucose of 126 milligrams per deciliter or greater? Is it C, a fasting plasma glucose of 110 milligrams per deciliter or greater? Or is it D, a fasting plasma glucose of 200 milligrams per deciliter or greater? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what is truly being asked of you. So here the stem of the question states, what fasting plasma glucose reading is abnormal and a positive for diabetes diagnosis? All right, so this is straightforward. The STEM is telling you exactly what we need to know. So in this scenario, the nurse practitioner and NP student are discussing fasting plasma glucose readings. Now we know that there's various criteria to help you to aid in the diagnosis and confirm the diagnosis of type 2 diabetes. And we always say we need two positives. So fasting plasma glucose is one of those that can be positive. So this question is asking you which range of that glucose reading is abnormal and a positive for a type 2 diabetes diagnosis. The best answer is B. Remember, fasting plasma glucose of 126 milligrams per deciliter or greater is considered abnormal as well as a positive. And when I say a positive, as in you can count that as one that meets the criteria for the confirmation of type 2 diabetes. And if you have another, then it will confirm that diagnosis. And as we build, I'll go through all of those with you. Also, if you're struggling with these, I do have a diabetic video. I can add it into the description for you to review, but know that we will be covering it as we continue through this series. Question number 2, what is the first line oral therapy for type 2 diabetes? Is it A, sulfonylurea, B, biguanides, C, P1 receptors, or is it D, the DPP4 inhibitors? Take a moment and tell me what you got in the comments, you guys. All right, so here the question is the stem of this question, right? So what is the first line oral therapy for type 2 diabetes? The best answer here is B, biguanides. And I did it in this fashion because, it's always a method to my madness. I want you to also know the drug classes that these things fall into, because this is one of those simple knowledge questions. We know metformin, aka glucophage, is that first line oral therapy, right? For our diabetics, we go with that first. But I also want you to know that that's considered a biguanide. So if you are approached or provided any of those terms or names, and you're not getting stuck, okay? And then lastly, question number 3 for today. At what A1C level is insulin initiated? Is it at 8, 10, 15, or 6.5? Again, at what A1C level is insulin initiated? Is it an A1C of 8, an A1C of 10, an A1C of 15, or an A1C of 6.5? Take a moment and tell me what you got. All right, and here, same thing. The question is the stem is the question. So at what A1C level is insulin initiated? And the best answer here is B10. An A1C of 10 is where we typically initiate insulin therapy, most commonly starting with a basal insulin, meaning one that covers on a longer span, but we'll get into that a little bit deeper so that you can easily understand it. So I just wanted to give you these quick little foundational questions, and you'll see throughout the week as we build and expand on some of these topics. Okay. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1 at gmail.com. Now, the things that I do offer are my review book. You can get it in a paperback or ebook option. They're both linked in the bio of this channel. If you are someone who prefers to review independently, my self-paced review for family and adult Gero is also linked in the bio of this channel. If you are looking to do practice questions, my QBank options are linked in the bio of this channel. And if you're looking to book a one-on-one session with me, I always say either a call, text, or email, because I have various one-on-one sessions and packages, such as sessions for weaknesses, question analysis sessions, sessions for our custom package, exam readiness assessments. So I always like to gauge what you're really needing before you just go and book a session, so we can make sure that you're getting the appropriate one for the most success for you and where you're trying to go. Okay. So again, if you need any of the resources that I do offer, feel free to reach out to us. But as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.